Okay, so what hematopoiesis is, we're breaking down all of the blood cells, figuring out what they do. It's actually really interesting because it'll start to come into play with all the disease processes that we do. That's why I love this so much, because it really makes sense. Okay. All right, so we're going to start with erythrocytes. Yeah? Erythro means? Like red. And cyte means? Like cell. Yeah. So these are red blood cells. What's their main job? All right, that is their job. So please do, just because anemia causes bruising, people think it has something to do with bleeding. Red blood cells have nothing to do with bleeding as far as their function. Clear? Mm-hmm. All right, so their job is to carry O2. What is oxygen's job?
To help with perfusion.
Yeah. How does it help with perfusion?
Oxygen's job is to oxygenate you.
I would like to know more about how oxygen's job oxygenates you and what oxygen does. Why do we need it? Oh my God, this is so awkward.
Your muscles need it, your organs need it.
Okay, your muscles need it and your organs need it. What does it do?
Do
y'all see what I mean? Yeah? Okay, so everybody always says we need it for life. How so? So once it gets into the cells, what does it do? You're on the right track.
It changes it. Energy.
How?
The fire that burns. So it transports it and uses energy.
Oh yeah.
Is it part
what
of
is it called?
Yes.
Yeah.
All right. So once oxygen gets into the cell, it starts a fire. Mm-hmm. Okay. And the fire that it starts burns the glucose that's inside the cell. The only way to actually use glucose for energy is to transform it into ATP. Oxygen is the fire that lights that to burn the glucose into ATP energy that our cells can actually use. Okay. Now do we know what oxygen does?
Yes.
Sweet. Okay. So, that was awkward. I swear, I would say 99. No, this happens every time I say, what does oxygen do? And not a soul knows, because nobody explains it like that. Yeah. So do we understand what it does when it gets, do we need it for life? Yes, you guys were correct. Does every cell need it? Yes, you were absolutely correct. But it actually has a function inside your cell. Okay. So the red blood cells carry that oxygen to the cells where the oxygen burns the glucose into ATP for usable energy for every cell of your body. Mm-hmm. So if your cells do not have oxygen, we do not start a fire, right? You cannot change glucose into ATP, therefore that cell does not have energy, so what happens to the cell? It dies. Now do we understand? Yes. Okay, so red blood cell total is 5 to 6 million red blood cells, but honestly, we hardly ever use red blood cells as an indicator of anything, because you can have a kabillion red blood cells, and if they do not function correctly, then it doesn't really matter. Great. Okay, so we're going to talk about the function of the red blood cells, what they do, and how they get oxygen where it needs to go. Okie doke. Yes. Okay. All right, so that's why I'm holding this pillow. It wasn't just for fun. But it is kind of nice to just hold pillows. It makes you feel all snugly and safe, like an adult pacifier. All right, so we're going to turn this over this way. So this is the red blood cell, right? Mm-hmm. Okay, the actual red blood cell itself does not do anything. It's just a structure holder. So that's why doing it, do we want to see the red blood cell count? Sure, I'll take a look at it, right? But the red blood cell count itself doesn't mean anything, because this guy by itself doesn't do anything, okay? But what it does do is, if you turn it this way, all right, we've got this brown substance. What is the brown substance that sticks to the red blood cell? Iron. That's iron. Okay. So this is actually, red blood cells are actually like a jelly donut. You've seen them. They're concave and they're, they've got weight to them, right? So a red blood cell is solid and I can hold it in my hand. It's obviously not this size, right? But I can hold it in my hand. It is solid. So we need to keep that in mind when we talk about anemias. Okay. If you have a whole bunch of red blood cells, what happens to your blood viscosity? It's going to thicken and increase. And then what will happen to your blood pressure? It's going to increase. What happens if you have anemia and you have very little solid in your blood?
It's going to go down.
What's going to go down?
It's not going to be as thick.
Okay, it's going to be very thin blood, which what happens to your blood pressure? It's going to go down. Then what will happen to your heart rate? It will go up as a compensation. So you already have 6 signs and symptoms of anemia just based off this. Okay, so this the icing part here, this brown part is iron. It's sticky substance. Its job is to make the hemoglobin stick to the oxygen. Okay, there are 4 chairs of hemoglobin per red blood cell. We know this, yes? Mm-hmm. All right. So there are 4 chairs that stick here. Without the iron, they can't stick. That's what causes what disease? Iron deficiency anemia, because if there's no sticky, the chairs can't stick, and so we can't carry oxygen. Clear? All right, so we got the iron here. Yeah, the 4 chairs are gonna stick. 1, 2, 3, 4. All right, so at this point, we're gonna think of this as kind of like a little Uber, all right? Because we gotta get the oxygen where it needs to go, all right? So once the hemoglobin can stick, if there's adequate iron, okay, then the oxygen can come and sit in each of those chairs, okay? Sometimes the Uber is full and all 4 chairs are full. Your SpO2 will be 100%. Okay, because an SpO2 means the percentage of hemoglobin that is saturated with oxygen, or how many oxygens are sitting in the hemoglobin chair. Okay, so if all 4 chairs are filled in this Uber, then we are at 100% occupancy. That's SpO2 of 100%. Do we understand that?
Yes.
Okay, if only 3 of the chairs are full, what does that mean? Your SpO2 would be 75%. That is very bad. And it's looking at the average of all your red blood cells. It's obviously not just taking one. Right? That's why you can get a percentage of 87 or 92 or what have you. Does that make sense? Okay. Once the chairs are full, now it's got to go where it needs to go, right? So the Uber is going to take it through the blood supply into all different places and all different cells, right? But can a whole red blood cell fit through a teeny tiny capillary? No. So once the Uber gets to where it needs to go, it tells the oxygen in the seats, the hemoglobin seats, to hop off, okay? So the oxygen will hop off of the red blood cell. Okay, that is a oxygen hemoglobin dissociation. They're going to dissociate and hop off. So if you've ever heard of the hemoglobin oxygen dissociation curve, that's what that means. When the oxygen hops off the Uber, okay, and then the oxygen molecules can fit through the tiny capillaries to get into your cells. Once the oxygen's in your cells, then what does it do?
Takes the fire.
Lights the fire. And it does what? Burns the glucose into ATP, which is usable energy for your cells. Okay, when you start a fire, right, what comes off the top of the fire? Smoke. That's the byproduct of the fire, okay? Well, we can't obviously have smoke inside our cells, right? That's waste. What is that waste product that comes off the fire? CO2, right? So then the CO2 is going to go back into the blood vessel, hop back on an Uber, so it's going to hop onto this red blood cell, go back up to the lungs where you exhale all your CO2.
Oh my gosh,
Is that life-changing?
so much
I know.
sense.
Okay, so whenever you're breathing in and breathing out, you're not just switching oxygen and carbon dioxide. You're taking a breath in, that oxygen's going in, it's hopping on the Uber, it's taking a huge journey. And when you breathe out, that is stuff that has taken a massive journey, right? It has already come into the lungs, it got into the blood supply, it hopped on its Uber, it went to your heart cells, it burned glucose for energy, the CO2 came back out, jumped back on the red blood cell or hemoglobin, and came back up. So that's old. That's why CO2 is considered like a waste product, right? Because it's the waste of what was happening in your cells.
That just made it great.
Made sense?
Yeah.
Okay, everybody happy?
Yes.
Great deal. I love Ubers. They're so vital to our life. Okay, so lifespan of red blood cells is about 120 days, okay? So what happens, remember I told you this was a jelly donut, right? Okay, so the red blood cell has been Ubering for 120 days and it's starting to get worn down and tired, right? Okay, so after that, your body will apoptose it. What is apoptosis?
Cell death.
Cell death. Okay, so the cell, it programs cell death, right? So it will say like, I am sorry, we are taking you out of commission, you die, okay? So when the red blood cells die, they're gonna break open, okay? Since this is a jelly donut, we have what inside? Jelly. All right, so what is that jelly? The junky stuff that was left inside the red blood cells?
Waste?
It is a waste. What waste is it? It's bilirubin, okay? So once the red blood cells lyse open, the bilirubin comes out. It goes into the
Spleen.
liver, okay, where the liver breaks it down, metabolizes it, and sends it into your,
Spleen.
nope. You love that spleen though today. It sends it into your,
Is it your urine?
nope, your poop. It puts it in your poop, and that's one of the reasons why your poop is a brown color, because bilirubin is a brownish yellow color. Are we clear on this? Now, the rest of the donut is broken open and all jacked up, and where does it go, Marissa? To your spleen. The spleen is the graveyard of the red blood cells, and the spleen will break down all the red blood cells, rejuvenate them, and pop them right back out. Do we understand red blood cells? Okay. So when we are looking at function and how well your body is oxygenating, do you understand why we do not look at the total red blood cell count? What do we want to look at? Hemoglobin and hematocrit. What is the difference between the two? The hemoglobin is what?
Is it the size?
It's an amount that is on here. Okay. What is the hematocrit?
The size.
That's a percentage. It's a percentage. It's the hematocrit is the,
What am I thinking about?
I think you're thinking of MCV and MCHC.
Yeah, that's what
Yeah,
I'm
those are
thinking
the
about.
size of the red blood cells. All right, so hemoglobin is the amount of hemoglobin that is present on your red blood cells. Hematocrit is the percentage of your blood that is red blood cells. Do we understand?
Mhm.
Okay, so let's say you drank 6 gallons of water this morning before you got here. What would your hematocrit look like?
This is where it's like inverse, right? Like what you
No, it's
normally think.
no,
If
I
you've
think
got
it's
more
normal.
Water in your, if you've got more like substance in your blood, then your hematocrit would go down.
Yes, your hematocrit will go down because
There's more
water to,
Yeah.
remember we said this was solid and I can hold it in my hand.
Mhm.
So your blood is made up of solid things like white blood cells, platelets, red blood cells, okay? And then it's also made up of the liquid portion. What is included in the liquid portion? What is the liquid portion of your blood?
Water.
But what is it?
Plasma.
It's plasma, because plasma is made up of 99% water and 1%?
Sugar.
No.
Everything else.
Nope, well, it's something real important. Which is why when patients have problems, certain problems, we give them fresh frozen plasma.
Clotting
No. Clotting factors. The rest of it is clotting factors. So when you have a patient that's having a massive hemorrhage, what blood product do we give? Fresh frozen plasma, because it has clotting factors, especially what type of patients would need FFP. Who needs clotting factors?
People that are bleeding.
People that are bleeding, but what type of people specifically need clotting factors? Because if you're bleeding, I can give you a whole blood transfusion,
Like,
right?
oh my. Oh.
Mm.
My brain's.
Okay.
Could it be like trauma patients? Or
Trauma, we can give whole blood because they need volume and they need blood, right? They need the red blood cells. So we would give them whole blood. What kind of patients do not need volume, but they need clotting factors? I would ask myself, where are clotting factors made?
in the liver?
In the liver. So what patients would need FFP?
Oh, like liver.
Liver patients like liver failure, cirrhosis, because when you have a problem with your liver and your liver makes clotting factors, you're deficient in clotting factors. All our liver patients bleed. All of them bleed because they're lacking clotting factors, platelets, and vitamin K, all of which are made by the liver. Do we understand? Okay, so back to my point. Okay, so we've got plasma, that's a liquid portion, right? And then we have the red blood cells, white blood cells, platelets, and other things that are the solid portion. So if I drank a whole bunch of water, my hematocrit would go down because the percentage of solid is now, it appears to be less.
Mhm.
Doesn't mean that my red blood cells died. No, it just means it's going to appear to be a less concentration. Now, what happens if I'm dehydrated?
Yeah.
The hematocrit will go up. That's called hemoconcentration. Okay, so just because someone's hematocrit is high, we could probably just say like, hey, you need to water that down a little bit. You know, you're dehydrated, drink some more water and it'll fix that problem. Are we clear on that? That makes sense?
Mhm.
So the hematocrit is the percent of the
Hematocrit is the percentage. The hemoglobin is the amount. Okay?
So when you start like, you can get like overhydrated. Like when people
Yes,
have,
you can
like,
get overhydrated.
Is this kind of the first issues that it
No,
causes?
this is not the worst issue. The overhydration waters down your sodium.
Oh, okay.
That will cause
Okay, yeah.
hyponatremia, cerebral edema, and death. That's how people die of water intoxication. It's a sodium problem.
But if you do like a blood panel, the hematocrit will be low though if they are overhydrated, right?
Mhm.
Yes,
So-
but
I
the
just
the
meant,
reason
like,
why
are they
that
gonna
doesn't
run
kill
out of
them,
oxygen first?
no, because there's nothing wrong with this.
Yeah.
There,
Okay.
this is all working correctly, right? The oxygen is still attached. Nothing has changed. Just the percentage is going to look different. Your hemoglobin may not even really change that much, right? So they're still oxygenating just fine. No, it's perfectly fine. Oh, we
It's just
understand.
the concentration.
It's
is
the
less.
concentration, right? So I would just use it in practice and say like, oh, okay, they're either dehydrated, or hemoconcentration,
Mhm.
or the opposite.
Yeah.
Okay? All right, so as far as hemoglobin and hematocrit are concerned, the numbers, I mean, you can memorize them. You'll see a whole bunch of different resources say a whole bunch of different things, okay? Easiest way to remember it is to know when you have to do something, okay? So hemoglobin less than 11, we have to do something. So in general, just so you know, a normal hemoglobin is somewhere between 14 to 18 for males and 12 to 16 for females, okay? But you need to know, as far as like NCLEX studying and class studying, when do I need to do something? When do I need to report it? When do we need to do something? So when people's hemoglobin goes below 11, you're probably going to start to see some changes in the patient. They may be more fatigued, their blood pressure may go down. So we have to do something, okay? Now I'd probably do a workup for anemia, maybe put them on iron if it's iron deficient, find out why they're anemic. We got to do something.
7 is when we do a transfusion, right?
Yeah, below 7, a hemoglobin less than 7, they're going to start having oxygenation problems. So less than 7, we transfuse. Some hospitals, their protocol is less than 8. Okay. But definitely at less than 7, we're going to have to transfuse because they are going to start to have oxygenation problems. We got it? Okay. Are we clear on everything that has come out of my mouth so far?
Yes.
Okay. Important to note is all the different things that go into making healthy red blood cells. Okay. So first and foremost, everybody knows your bone marrow makes red blood cells, right? Y'all knew that. Okay. Did you know that your liver does? Your liver helps to make healthy red blood cells, and it cleans all the red blood cells that you have. So as your blood goes through the liver, it cleans them, makes them really nice, and sends them back out. If it doesn't do that, then your body's going to say, ew, that's a nasty red blood cell. And then what's it going to do?
Get rid of it.
It's going to lyse it, right? So your liver is very important in red blood cell production. That's why our patients that have cirrhosis, liver failure are very anemic. Are we clear on that? Mm-hmm. What tells your body to make more red blood cells?
Oh my gosh, I know what it is.
Oh, I cannot wait to hear it.
To make more, is it the kidney?
No.
Yes, what in the kidney tells it to do it? Erythropoietin. So erythro means red blood, or red, yes, okay. And poietin,
Like create.
to make. So it's literally telling you it is a hormone that your kidney produces that makes red blood cells, okay? So in patients that have kidney failure or an AKI or CKD, right?
Oh,
Then
you
those
have to
patients
give
are
them-
not making erythropoietin, so they're not making any new red blood cells. So our kidney patients will also be severely anemic.
So you give them erythropoietin.
You can actually give synthetic erythropoietin. It's called epoetin alpha, okay?
Oh,
Yeah, and you can give it to them to help with that. All right, we know iron is also important, right? If you don't have the iron, you're going to have some type of anemia. I'm going to tell you this because this is very important. Anytime you hear someone say like, oh, they're anemic, are they on iron? How many different anemias are there?
A lot.
A kabillion, right? So just because they're anemic does not mean they need iron. Once we determine they have anemia, let's say we did a CBC and their hemoglobin is 9. I'm like, okay, this patient's obviously anemic, right? But I need to do a full workup to find out why. Because as you can see, a patient could have a liver problem. They could have a kidney problem, right? They could have a vitamin deficiency. They could have an iron deficiency. They could have sickle cell anemia, megaloblastic anemia. There's a million different kinds. So we don't just throw iron at every anemia. We want to find out there is iron deficiency anemia so we can treat it with iron. But it can be very dangerous in other patients with anemia. Okay, what type of anemia can you never give iron to because it is toxic?
Yeah.
Mm-mm.
Oh, okay.
I feel like most
I
people
know
just
there
stare at
is
my
one.
face to try to get the answer. Do you want me to teleport it to you?
Oh my gosh. I know there is one.
Me too.
Can you say the question one more time?
What type of anemia should you never give iron to because it can cause iron toxicity in that patient?
Why don't you start listing some anemias?
I did already. I listed y'all a bunch of them.
Sickle cell?
Yes.
Oh,
Very good.
okay.
It is sickle cell anemia. Because they get so many blood transfusions, there's iron in the blood, right? So they get tons of iron all the time. So we do not give them iron supplements because we can't actually cause them to go into iron toxicity. Good job. Okay, other things that go into making healthy red blood cells that make healthy oxygen is folic acid. Okay, what's folic acid's job?
Healthy red blood cells.
Okay, healthy red blood cells. It does a lot of other things too, but for this purpose, that's important. And then B vitamins. Your B vitamins are very important in making healthy red blood cells. Who makes your B vitamins?
Liver.
The liver. So you can see how liver patients bleed all the time because they're deficient in so many things. Yeah. Yep. They bleed for lots of reasons. Okay. They bleed because, they lack platelets. The liver makes platelets. They bleed because they lack vitamin K. Yeah. They clotting factors, the liver makes all of those things, so they bleed. And then our patients that are deficient in B vitamins, if we don't make healthy red blood cells, right, those red blood cells are going to lyse. So a lot of our patients can also get hypoxic when they have liver issues, okay? And if all these red blood cells are lysing, where do they go? To the spleen. So they're going to end up getting splenomegaly as well, because the spleen's going to swell with all those different red blood cells.
Would they go like into hyperbilirubinemia?
Yes, most of our anemic patients too, like liver patients will do that. And also our anemic patients can get jaundice because it's lysing all of these red blood cells that are not healthy. Yeah.
Mm-hmm.
And then like in sickle cell anemia, there is a one type of sickle cell crisis called a splenic crisis, where all of their red blood cells are lysing prematurely. They all go to the spleen gets really enlarged, and then their spleen can rupture and they can die from hypovolemia. Okay. All right. So we understand all the things that are important to make this nice jelly donut.
Yeah, lots of things.
So the
Lots of
So
things.
the hemoglobin is the seats on the jelly.
The hemoglobin are the seats. Yep. Do you understand?
Mhm.
Okay. So next we are going to talk about actual just anemia as a whole, okay? And we're going to walk through the signs and symptoms and why, now that you know what the red blood cells do and kind of how it works in the body. Okie doke?
Mhm.
Okay.